When you talk about nutrient deficiencies that you're seeing, I mean, I know one of the major problems is the industrial food kind of complex that exists in the United States, and it's depleting our minerals. So, with the farming practices, for example, I've just seen some statistics about how our food sources are just like completely mineral depleted. And that's even if you're eating organic. Now, if you're not already eating organic, then you're exposing yourself to pesticides. So those are extremely problematic. And there seems to be some war on meat that's going on globally. So you see all the nutrients that somebody can receive from like red meat, for example, aren't obtained because they have some negative belief about eating red meat because of what's pushed on the country. So my question is this: is how are we able to obtain what we need nutritionally in the United States? And when people are chronically depleted, as you state, um, how may that manifest itself in psychiatric system or psychiatric symptoms where the conventional medical system then like mislabels them as if they have some, you know, genetic psychiatric condition that they have to prescribe a pharmaceutical for?
Right. So, okay. So you asked a few things there. How do they get adequate nutrition for, okay. So I agree with you. I do think I work with people who are vegan. I work with people who eat a lot of animal-based products. I support both sides, whatever someone feels comfortable with. I just educate on both. So, um, you absolutely, once again, it's like you can get what you need if you are consuming these healthy foods. And so these are like the patients I'll get is they actually are very adamant about getting a wide range of their nutrition, right? Like maybe they are getting they're eating steak, they're eating fish, they're eating vegetables, they're eating their fruits, they're trying to get good fiber and whatever. But then they're still depleted in a way, and that's where then you would have to see once again, like I was starting with that stress response, like if your stress is constantly up here, then you're not even going to be really absorbing as well as you would think with a good diet, right? So really like the key for a good diet is making sure you're getting adequate protein. And so in terms of the mental health piece, a lot of times if you just up someone's protein because so many of these amino acids are precursors to these neurotransmitters that we need to feel okay, um, that helps a ton. So yes, you can do that through meat. Like you can do that on a plant-based too, fine. Like truly. Fiber is super important. Fiber is really important because of your gut health in general. So I think you know this, you've talked to people about this too, like the different species that you can get or the different types of foods that you can get equate to a more diverse gut microbiome. So the gut species. That has been shown to improve mood in people that have struggle with mood, depression, anxiety tend to have fewer gut species, right? So if you stick to just the one thing you're eating all the time, that doesn't always contribute or help, even if it's like an anti-inflammatory um, diet. Like some people just go all animal based. It doesn't always equate to the healthiest gut microbiome, which could create problems later. But your mood could be stabilized because you're eating enough like healthy amino acids.
So you don't.
Yeah.
So let's define this. So Paul Saladino talks about animal based, right? So
Hmm.
animal based would be high, grass fed beef, dairy products, and he includes fruit and honey. But then
Hmm.
there's the keto community and the carnivore community, where I mean they're focusing pretty much on, grass fed beef, animal products, such as eggs and so forth.
Yeah.
So you're saying that you would have some concerns regarding that as far as it being like diverse enough for the healthiest gut microbiome possible.
Yeah. And so there's definitely times like with certain brain health conditions where a keto diet can be super beneficial. But I think for an extended period of time, it's really not the best way to go. And especially So here, I was just saying, so it's like if stomach acid levels are off, or if your gallbladder isn't secreting bile to break things down, or if you already have a sluggish liver for XYZ, like you're on medications, you don't eat that well, you don't exercise, whatever, right? If you're eating that much um, protein, it can actually cause people to, um, like I've had patients that have almost gone into like not like a shock state, but their body will start breaking down. Like they'll almost become more inflamed because it's so much stress to break those foods down. So we need to like ease into that much protein too. Does that make sense?
Yes. Yes.
Okay. Yeah. And especially if once again it's like if you have a hypo stomach acid state, low stomach acid state, it is going to be harder for you to digest that much protein. So it's not exactly like where you'd want to start, I guess is my point.